if you want to claim that title these days.
Good evening, everyone, and we'll call the Tuesday, December 5th, 2017 meeting of the Everett Planning Commission to order, beginning with the roll call, please.
Chair Holland.
Here.
Commissioner Tisdall.
Here.
Commissioner Jordison.
Here.
Commissioner Beck.
Here.
Commissioner Zielinski.
Here.
Commissioner Lavera.
Here.
Commissioner Yanasak.
Here.
Commissioner Lark.
Here.
First item on the agenda tonight is the approval of the minutes from November 7th. Has the Planning Commission had an opportunity to review the minutes, and if so, any comments or corrections or motions? Commissioner Zielinski?
I just have one minor correction. Mr. Neil McIntyre is one of the downtown businessmen who testified last time. And it says here that it refers to his restaurant. I believe he actually operates a barber shop downtown.
Oh, okay.
Any other comments or corrections?
That's who that is.
Seeing none, do I hear a motion?
I would move approval of the minutes.
Second.
Any discussion? Okay, call for the vote.
Commissioner Yanasak.
I think I'll abstain. I have not reviewed them. I was not a part of the last meeting, although I did watch it, but.
Commissioner Lavera. Yes. Commissioner Zielinski.
Yes?
Commissioner Beck.
Yes.
Commissioner Jordison.
Yes.
Commissioner Tisdall.
Yes.
Chair Holland.
Yes. Any reports from the planning commissioners? Commissioner Lark?
Nothing to report.
Commissioner Yanasak, any of this opportunity to report on anything that you...
I guess I have nothing to report. I guess I just want to say I've had a chance to meet all of you. I'm happy to be here. Thank you. Looking forward to this opportunity to serve.
Welcome aboard. Pleasure to have you. Commissioner Lauber? No. Commissioner Zielinski?
No report?
Commissioner Beck?
No report.
Commissioner Jordison?
No report.
Commissioner Tisdale?
None.
Okay. Any staff comments?
Yes, Alan Giffen, Planning Director. Do have a few comments, and I'm going to start by, first, I want to acknowledge this is Richard Jordison's last meeting as a Planning Commissioner, and I want to thank Richard for his contributions as a Planning Commissioner, and he's added a lot of thought-provoking discussion, if not brevity, to our discussions as a Planning Commissioner, and I'd like, we got a little going away present for you.
Oh, my goodness.
Thank you, sir.
Yeah, thanks for that.
Done.
Any comments, Commissioner Jordison?
Oh, that's very nice. Thank you, Alan. And it's been an honor and a privilege, and you're a fine group of people, and what can I say? You know, America's finest city. Thank you, and as I leave here, I'll probably be leaving after the first agenda item is voted on, and I want to wish you all the best of luck.
Great. Thank you. It's been a pleasure serving on the commission with you.
Thanks.
Thank you.
I had a few other quick items here. First of all, wanted to remind commissioners that next Tuesday at 4 p.m. at the Edward Hanson Conference Center in the Xfinity Arena will be the annual Mayor's Boards and Commissions reception, and you're all invited and encouraged to attend that. I highly recommend it. Secondly, we will have no meeting on January 2nd. Our next meeting will be on January 16th. Next year. Then.
Not on the 2nd then, Alan? The 16th?
Not on the 2nd.
Okay.
We will have no meeting on January 2nd. And then my last comment, I'd like to invite Bob Leonard from the Parks Department to come up and talk a little bit about the tree committee. So, Bob?
Bob Leonard, I'm the Assistant Director for the Parks and Community Services Department for the City of Everett. Thanks for having me, and thanks for allowing me to speak. Part of my duties as the Assistant Director is to oversee the tree committee. One of the things I did was to go back to the ordinance that authorizes there to be a tree committee. And when I was looking through the ordinance, I found several, what I found to be very interesting things. Number one being particular to this group is that the tree ordinance mentions specifically the Planning Commission no less than 7 times. So there is a big correlation between the tree policy and the Planning Commission. I really appreciate citizens that get involved with their community, and I just want to say right off the bat, thank you for everything you do, but I am here to ask you for something, so let's keep that in mind. One of the points that really struck me was where it talks about this ordinance recognizes by the city of the Planning Commission's and Park Commission's mutual responsibility relative to the review of policies and regulations concerning trees on city-owned public property and right-of-way. This ordinance also authorizes the Tree Committee, which is a subcommittee of the Board of Park Commissioners entitled the Tree Committee, is hereby authorized. The Tree Committee shall be advisory to the Commission. The primary responsibility of the Tree Committee shall be to review and make recommendations to the Park Commission concerning the implementation of the public tree policy. Provided, however, on issues concerning the revision or establishment of standards or regulations concerning the city's urban forestry, the Tree Committee shall provide its recommendations to the city's Planning Commission in addition to the Parks Commission, since these issues may affect the city's comprehensive plan, zoning code, subdivision code, and other land use regulations. The Tree Committee shall consist of 7 members. To the extent practical, the following shall compose the Tree Committee. 1 representative from each of the following groups: the Council of Neighborhoods, the Historical Commission, the Planning Commission, and the Board of Park Commissioners, and then 3 at-large positions. So overall, I am going to try to plead the case to really try to get a planning commissioner to really think about the possibility of joining the Tree Committee. When this ordinance was written, I think it was written with a lot of foresight. Trees do affect the city, and I'm not really looking for people that care a lot about trees. I have a lot of people like that already. I really am looking for somebody that cares about planning and that is willing to take that planning desire, that planning focus, and then implement that on the direction for the trees for the city. I think that the way this was crafted, having all of these different boards and commissions represented on this subcommittee, the Tree Committee, to really take and evaluate trees on all those different bases is just a real good way of doing trees for the city of Everett. I don't want to just do trees and be tree focused. I want the tree policies and tree decisions to be interwoven in all the other decisions, the planning decisions, the historical decisions, the neighborhood decisions. So I really want to take the desire and passion that brought you to the Planning Commission and then use that on the Tree Committee. There's a lot of stuff here that's code that talks about Planning Commission working already. So I really need to have planning's influence on this anyway. I think having a planning commissioner be a member of the Tree Committee would be just a very good thing for the city. It says to the extent possible, so we have an out, but I really want to make sure that we have exhausted this possibility, because I really think it would be the best thing for the city. Yes, sir.
When does the Tree Commission meet?
So right now, we are currently meeting the 3rd Thursday, once a month at 6 PM at Forest Park, the administrative office at Forest Park. I say currently because things are changing. I have gone to the Historical Commission, I am here at the Planning Commission, and I will go to the other commissions. We're looking to get somebody from the Park Board to really try to meet the intent of this ordinance, because again, I really think that the way this was crafted is the best for the city. Are there any other questions?
Well, I suppose the commissioners can think about it and maybe get back to Alan then about people that might be interested in serving.
Absolutely. We do have
Or
some,
maybe you could educate the planning commission a little bit more on what it is that, a typical meeting lasts, and then also what exactly the discussions are centered on.
yeah, absolutely. Thank you. Typically, we just run from 6 to 8, so it is 2 hours. And I say typically because, again, things are subject to change, especially if we get new commissioners on, things could be determined. But the primary mission of the tree committee is really to talk about the tree policy for the city. So how we manage trees throughout the city. We have the open space trees in parks typically, and then we have all the trees on the streetscapes and stuff like that too. So anytime we have a tree on City of Everett property, it needs to be managed, and how that gets managed is really the responsibility of this tree policy, which is crafted and then overseen by the commissions.
Great.
Thank you for that.
Yeah.
And so for timing wise, like I think that we have some time. I have some open spots. I am looking for commissioners. But if I could, we'll reach out again and we'll try to answer any of the questions, and then we can start making decisions probably towards the end of the month. But so we have some time, but I really would hope that we could really think about, just because I really do think it's in the best interest of the city if we can make this happen. But again, I started out by saying it's a big time commitment. I get it. You guys are doing a lot of great work already, and it's hard for me to come and ask you this, but it is something that I really believe would be beneficial. And if it can happen, that would be great. Thank
Yeah,
you.
that'd be great. And maybe you could work with Kathy to send out just a little email reminder to the commissioner, since she has all our addresses, and maybe attach some of the policies and things like that we would be, wanting to know more about is related to the.
Great.
tree
Would it be
committee, yeah.
possible for me to leave my card some?
Absolutely.
I'll take one of your cards.
Yeah, I'll take one too.
And Catherine, didn't you serve on that for a time?
Yeah, I think I have some lessons learned from my experience. I actually was the tree committee liaison last year. And
If you don't mind, I'll just give you all a card.
Sure.
Thank you for considering it.
because you're new, correct?
Yeah, I've been with the city for about 5 months, so things
Okay.
are changing, so.
Okay.
Thank you.
Thank you.
I appreciate it.
Yep.
Yeah, feel free to contact me with any questions, anytime. I'd love to talk about trees and parks at any time, so
Great.
appreciate it. Thank
Thanks
you.
again.
That's
Thank
it from
you.
staff.
Okay. This is an opportunity from anyone in the audience that want to address the planning commission on anything that's not on the agenda. So if you'd like to do that, this is the opportunity to come forward now. Seeing none. We have 3 public hearings tonight, and so I'll turn it over to staff, and the first one is for the opiate substitution treatment facility.
Thank you. Alan Giffen, Planning Director. Our hearing was continued until tonight from the November 7th meeting. And just a little bit of background information. Our current code allows only one opiate substitution treatment facility within the city of Everett. And we've been having a discussion for quite a while to talk about amending the code to allow for a second facility somewhere within the city. And we've been looking at a couple of areas, the Broadway Mixed Use zoning along North Broadway, north of 24th Street. And the Planning Commission also asked us to consider adding the B3 Downtown Central Business District to a potential area for a code amendment to allow for an opiate clinic. In the B3 zone, we had considered a couple of potentials. One was the entire B3 zone, and the other would be the entire B3 zone with the exception of the designated retail streets in that zone, which include Hewitt Avenue, Colby Avenue, and a couple of blocks each on Wetmore and Rucker Avenue. At the last meeting, the Planning Commission asked staff to have the legal department take a look at how the Americans with Disabilities Act affected opiate clinics as they relate to zoning regulations, and if we really can treat clinics that cater to disabled people differently than regular clinics or other types of clinics. The legal department did that review and concluded that under federal case law, there have been a number of cases where the courts have ruled in favor of opiate clinics that have challenged local zoning regulations that treated such clinics differently, more restrictively than just clinics otherwise within their codes. And so that's a significant shift from the discussion that we've been having for quite some time now. So based on federal law, our code must allow opiate substitution treatment facilities as we would any other clinic. And in Everett, that's a lot of places. It's every commercial zone, it's every industrial zone, and it's even in some areas in multifamily residential zones where we have a clinic overlay. For example, the Everett Clinic area, or near Providence Hospital, the Pacific campus. We've heard a lot of testimony during our public hearings and workshops expressing concerns about locating an opiate treatment facility in the downtown. We've heard a lot of concerns about the potential effects of siting a clinic downtown, or just perceptions that people would have about the impact that an opiate clinic would have on revitalization of our central business district. We've also heard a lot of testimony in support of allowing a second opiate treatment facility to meet the need. Some of the concerns that we've heard expressed in addition to just asking questions about crime or will it attract more drug users have been from our economic development director, who has stated her opinion that downtown redevelopment and revitalization is at a precarious point in its evolution, and it's certainly more precarious than, say, some of the other urban centers around the Puget Sound, many of whom are also experiencing their own difficulties with homelessness and addiction on the streets of other communities. We recently had a discussion with somebody from the Department of Social and Health Services that licenses opiate clinics, and asked her for information that they may have concerning the incidence of crime around methadone clinics, if there's any literature or studies that have taken up this matter. And just this morning, when I got to work, found in my email inbox, links to several of those. I think those were forwarded on to the commission. But there was a study from the Baltimore area that looked at 15 different methadone clinics and the crime around those, and found that there was no higher crime rate around methadone clinics than there was throughout the region. There's also a study reference from the National Institute of Health showing a lower rate of crime during treatment by people who are suffering from opiate addiction than before they entered treatment. So the concerns and perceptions that you have heard and you've seen a lot of written comments about, and we'll probably hear more tonight, are certainly of concern to the city when we have that much of our business community who is expressing a concern about the impact that a facility may have if located in the downtown. I would like to point out that in your packet I've included information from the state RCW and the WACs on the siting of opiate treatment facilities, and would point out that there is a public process that the state follows that no matter what the federal regulations may say about zoning standards, there is a process that requires a sponsor to first approach the legislative authority of that community, being the city council here in Everett, to state the intention or their interest in locating in a city. And secondly, there's a requirement to hold a public meeting in the general area in which the proposed clinic would be located, and to reach out to stakeholders, neighboring property owners, business owners, and residents to hear their concerns, and also to produce a plan addressing the responses to those concerns that before they even apply for a license or approval from the State Department of Health and Social Service, DSHS, Social and Health Service, excuse me. And so there is a process that would be followed no matter where a clinic would be located, whether that was in downtown or another part of the city where a clinic would be allowed. So in your packet, the staff has prepared a resolution that would essentially bring us into consistency with federal law. What that would do would be to remove any distinction in our code between clinics and opiate substitution treatment facilities, and it would therefore allow an opiate treatment clinic anywhere a clinic would be permitted. If the Commission wanted to consider an option related to taking a different approach to the downtown area, we've identified a couple of options in your packet, and those are options that we've talked about previously, kind of reverse of options that we've talked about previously. And this would be to prohibit all clinics within the B3 zone, which would then not be treating opiate clinics any differently than a medical clinic, or to allow within the B3 zone, but just prohibit on the ground floor at retail streets. Again, that's Hewitt, Colby, Rucker, and Wetmore, where the city does take a little bit more restrictive approach to certain types of uses to try to retain those areas or preserve those areas for retail activity, restaurants, and so forth, so that it's a precedent that we already have in our code to take a little bit more restrictive approach in a couple of locations. So with that, I am done unless you have questions for me. And this is a public hearing tonight.
Thanks, Alan. Any questions of staff? We do have several folks that have signed up to testify, but any questions of staff before we open up for public testimony? Commissioner Lark?
I'm just a little more curious if you can kind of flesh out the process that was outlined in RCW 71-24. .59, the process for citing, you touched on it, but I just kind of want to say, can we do a bit of a complete walkthrough to see how, the community is able to engage with that process? And
I can't do a complete walkthrough. I'm not familiar with the process. I can tell you that you can read it faster than I can read it to you. But this is something that in our conversations with the representative from DSHS, this is the process that they do follow for any proposed opiate clinic.
Okay.
And so we have representatives of Therapeutic Health Services tonight. They've been through this process a number of times and can probably tell us a whole lot more about their experience, and perhaps if the commission wishes. But it's here in your packet, but I'm not an expert on it. I can't really walk you through it.
Roger that. If the commission will allow, I have just another question. So have any other municipalities adopted similar ordinances regarding the retail streets or preventing clinics on the retail streets? Is there any other precedent for that?
I'm aware of Marysville's ordinance because we had correspondence with Marysville, and Chair Holland works for Marysville and is familiar with that, but I believe that their ordinance allows for these opiate clinics in where it allows other clinics, but it does have some more separation requirements. It has to be certain distances from certain types of land uses, if I'm not mistaken.
That's correct, yeah.
Thank you.
Any additional questions?
I guess I do have a quick question. Do you know, Alan, other cities in the area, maybe just Marysville or maybe none, that have, I guess, made this effort to get into compliance with federal law with regard to ADA and have erased the distinction between opiate substitution programs and other types of medical clinics?
No, I'm not aware of whether or not that has happened in other cities. That may have, I just am not familiar with what the other cities there are requiring, other than our conversations have been really with the county, with Tulalip, and with Marysville because of the needs cited for facility and treatment in the North Everett, Marysville, Tulalip area.
Any additional questions? Okay. Well, let's open it up for public testimony here. I do have several folks that have signed up, but if you wish to testify on this agenda item, please fill out one of the speaker sign-in sheets and get it to Kathy, and we'll make sure we get to hear from you. So the first person I have is Clay Werthmeyer.
Good evening. My name is Clay Wertheimer. I am a resident of Everett at 1011 Grand, and I'm also pleased to tell you I'm the president of the Board of Directors of Imagine Children's Museum. And I'm here to reiterate what I tried to express on behalf of our Board of Directors in the letter in your packet. On behalf of the Board of Directors, I would encourage the planning commissioners tonight to take the necessary steps to prevent the location of an opiate substitution clinic in the Everett Central Business District. Our museum has been on the corner of Wall Street and Hoyt since 2005, and we currently annually take care of 250,000 children, primarily, and their caretakers who come through the Central Business District to visit our facility and take part in our exhibits and programming. We have, over the last several years, suffered the consequences of the overlap between social services concentrated in the Everett Central Business District and our presence there. We have had more people sleeping in front of our entrances, more individuals accosting and threatening our clients, and we have had more cases of our own employees being afraid to walk to their cars in our parking lots at night. Now, with the prospect of having an opiate addiction clinic next door, we're afraid that that pressure will only increase. And we're convinced that that fear is not based on unfounded knowledge. It's actually based on data. No treatment, and I'm going to wear my doctor hat here because I'm a board-certified orthopedic surgeon, and I had the opportunity to review the medical literature, including the literature that's referenced in your packet. No treatment facility has a 100% rate of efficacy. There's a certain percentage of patients that fail that treatment. And the current medical literature indicates that that percentage in opiate alternative treatment facilities is somewhere around 20 to 30% of the patients who are enrolled in those programs, unfortunately, continue to use and inject illicit street drugs, which therefore means they continue to buy, sell, and overdose on illicit street drugs. And that's confirmed in a British medical journal that I referenced in my letter to you. So this means that those folks that are essentially failing that treatment are going to be drawn in to our downtown business core. So although we recognize the need for opiate alternative treatment facilities and the need to address the opiate addiction problem, we strongly feel that that place should not be inside our central business district, nor should it be next door to a children's museum. So we, totally support your efforts to be compliant with federal law, and we totally support your being on the Planning Commission and realizing that zoning has a lot to do with the vitality of a city and the success of a city. Therefore, we encourage you, we being the Board of Directors of Imagine Children's Museum, to do your job to help prevent the location of an opiate alternative treatment facility in the downtown core, but provide that service to our community.
Thank you.
Thank you.
Next, we have Melissa Springer.
My name is Melissa Springer, and I'm the GM of the Hampton Inn. As I read the memorandum tonight, I have to say I was disappointed in the comment that says staff does not anticipate, based on the discussion, that the commission would be inclined to support either option. It appears to me that the decision has been made, certainly by the staff, that they don't feel that the commission is going to consider other options. I asked the Planning Commission to do their job, do their due diligence, and not punt it off to say, okay, we're going to open this wide open, and if you want an opioid clinic, there's a way that the people can stop it. To me, that's punting it. The Planning Commission is the people who are tasked with deciding what goes where in a city. If we didn't need that, we wouldn't need you. We need the planning department to listen to everyone. I am not against opioid treatment centers. I'm a recovering alcoholic addict, as I've told you. I understand. But at the same time, taking that hat off and saying what is good for the city, that includes economic development, it includes places where children are. This downtown core, the city has spent quite a bit of money. They talk about this, how they want to revitalize the downtown. That is part of the Planning Commission's job, is to say, okay, looking at this, is an opioid clinic, is any kind of clinic, if that's the way you want to go, should that be in the downtown core? And I maintain that it shouldn't. Opioid clinics, alcoholic clinics, anything that involves bringing people to this area should not be in the downtown core. I hear that we need a clinic. I get that. We need it someplace where people can get to it. I get that too. So is this committee willing to say that it has to be downtown because that makes it easy for people to get to it? I maintain no. I heard tonight Marysville Tulalip has an incredible need for this. Why would the planning department not protect the downtown core, saying, yes, we understand that it's needed, but it should not be in a retail downtown situation. It should be someplace where it has a chance to grow if it needs to, where parking is not a problem, where loitering is not a problem. That's certainly not near my business. I already have that problem. So I'd like you guys to take the job seriously on, do you punt it off to the city council and people who come up as need be because the state has a way to do it, or we take control of our own city and say, I don't think it's right for us downtown. We need it, but not downtown. Thank you.
Thank you. Paula Townsville?
Hello, my name is Paula Townsville. I live at 211 Capri Place here in Everett. I want to thank the Planning Commission for withholding a decision on this critical matter until a legal opinion was gained on the issue of discrimination against a protected class of residents, and that was clearly my principal issue when I spoke at the last public hearing in November. But now I'm asking for your thoughtful consideration for part 2 of my concern, which I also discussed, and that is the issue of the appropriate siting of the THS Opiate Substitution Treatment Facility or any other treatment facility or any medical treatment clinic or any medical or dental clinic, and my list goes on and on. I'm a land use planner. I'm looking at this from a planning standpoint. I'm not looking at it from what's appropriate to have next to my child, my parents, and so on. I'm not looking at it whether it's good to have it down by the boats. I'm looking at the city as a whole, using our zoning map, and saying, where do medical clinics go? It's a nuance. And again, I'm asking you to clearly look at the right of all clinics to locate in their appropriate zones throughout the city to better serve the needs of our community and residents. I'm particularly interested because I'm currently participating in the city's Evergreen Way Stakeholders Alliance group. We're working with businesses, residents, and property owners with a focus on Evergreen Way from 41st Street to the Boeing Freeway. I think we've heard a lot about the downtown core. I think it's time we hear about the Evergreen Way Alliance and what we think about our community, our neighborhood. I assure you that our area experiences significant impacts from social services and medical providers. We're clearly anticipating further impact as we look at the upcoming low-barrier housing on Berkshire to be run by Catholic Community Services, and the psychiatric beds that are coming soon to Evergreen Way to be run by Sunrise Services. In the letters that were submitted in the packet that I went through when I arrived tonight, I noticed things like the fragile recovery of downtown Everett, as well as the extensive petty crimes issues that people experience and the drug-related medical emergency responses. And I want to assure this commission that you can look at my 911 call records for the last 5 years, and you'll see we have that same problem in the Evergreen Way area. This is not unique to North Everett. It's not unique to Casino Road. It's not unique to Evergreen Way. It is a citywide issue we have. Drug addiction is a major issue, and we're in a big pharma lawsuit right now. So, while the downtown has a precarious recovery, the Evergreen Way businesses, who will likely be happy to come in and testify if it's being punted to them to deal with this, have yet been allowed to start a recovery. The Evergreen Way Alliance is not a group that you really want to fight with. Trust me, they've already been through Berkshire and the low barrier housing. We really don't want to deal with this too. If the need is there, and we need one in North Everett, and we need one in Central Everett, and we have the one in South Everett, so be it. But nobody gets a free punt. Not in my neighborhood. Let's not make this a NIMBY issue. Instead, let's treat it appropriately with the best practices for land use and zoning. The Metro Everett area has historically been home to hospitals, the medical dental building on Colby for decades, the old Bethany, now Compass facility on Broadway, the Drumheller ENT building, the Trask Surgical Center, and many, many more clinics and medical facilities. This is all to say that our community has spread out these services along transit corridors, nearest the population hubs, where market demands and space availability has allowed it. Much like schools, they are throughout our community, they're where they're needed, and appropriately placed by zoning codes. All this has occurred without a need to single out neighborhoods to receive more or fewer of these uses. I encourage the Planning Commission to reflect on the goals of the Metro Everett Plan and to realize that we are looking to a future population that will only grow in numbers, needing medical clinics, both with population numbers and the aging of the baby boomers. I'm hopeful that you will allow each type of medical clinic, whether it's dental, optical, women's reproductive health clinics, or if it's opiate treatment facilities, locate them according to their business models, projection of their needs, their budgets, their space availability, and so on. It's not for us to decide where they go. We don't choose. We only need one. We don't know how many we need. They know how many they need. They're the medical professionals. Let's let them do their work. They're the businesses that are in the business of treating addiction. Let's let them do what they need to do. Good planning begins here, and it begins with each one of you. That's why you're on Planning Commission. That's what you serve to do. So again, I respectfully ask that you remove the barriers now, and thank you for your time.
Thank you. Christopher Glanz?
Christopher Glanz, I live at 211 Capri Place. I was told I should stay on script. So I'm going to try, even though I've got about 4 decades of experience working in the mental health and drug and alcohol substance abuse field. I also am a scientist. I can review literature and I use the scientific method to look at studies. And I don't agree with using one study to try to draw a different conclusion. Okay, right now there's a preponderance. If you look at the research, there is a preponderance of evidence to show that opioid substitution treatment sites work. I've seen a good many treatment modalities come and go over the years. And opioid substitution treatment has been researched, investigated, peer-reviewed, and scientifically proven to be effective, valuable, and beneficial form of treatment. I don't think there's any question about that. The research abounds. But what there isn't any research to demonstrate is that it has a dramatic effect on the neighborhoods where it is. There is no evidence anywhere in the literature, despite what someone might say, that demonstrates that there's any influx of drug users or people in an area where just because the site is there, the treatment site is there. There's no evidence of that. And you can't make that up and have it be true, no matter how many times you say it. there's already people downtown using drugs. There's already people using intravenous needles. There's already these folks there. There's no evidence to suggest that a treatment facility is going to increase that anywhere. Period. If members of the community want to effect a change in the amount of, and see a reduction in the harm, that's caused by drug abuse, drug addiction, and this opiate crisis, then an opioid substitution treatment facility should be cited, as would any other medical facility, in accordance with the zoning, and so that the people that are running that, the THS, can have the chance of having the greatest benefit to the community and to the people who are fighting the good fight and trying to recover from addiction. That's who we need to be concerned about. Thank you.
Thank you. Debbie Warfield?
My name is Debbie Warfield, and I live at 640 Alverson. And thank you for letting me share my thoughts tonight. Can you imagine being told your child or loved one is not worth saving or denied treatment because of fear, stigma, or zoning policies? I have lived through that stigma. We are now in an epidemic of opioid addiction and death. And yet, what do? We continue to make it difficult. We make it hard for people to access medication-assisted treatment. This should be the easy part of addiction, not the hard part. We need treatment on demand with no barriers. That would save lives. It will not get rid of this awful epidemic, but it is one piece of a very large puzzle. Since our medical communities still remain silent, we have no other choice in moving forward with helping those suffering. As a city, we must remove the stigma and the shame that has been put on this disease of addiction. Stigma is truly what is killing those affected. Stigma is a major upstream contributor to all drug-related deaths. It works insidiously, snaking its way into everything from everyday personal interactions up to institutional policies, like what we're discussing tonight. The science is clear. Zero-tolerance drug policies do not work. And harm reduction methods like medication-assisted treatment and the distribution of naloxone do. I want to see our zoning codes not be discriminating. I believe as a city we can work together to add another opioid substitution clinic in an area that will be beneficial to all parties. My hope and purpose is when one of your family members are in need of this type of medical care, it is available. And you do not need to give the ultimate sacrifice that my family has in the name of stigma and lack of medical care. Thank you.
Thank you. Sydney Marshall?
Hi, my name is Sydney Marshall. I live in the Cascade View neighborhood here in Everett. I am an addictions counselor and case manager who in the past worked in King County for 5 years and now currently in Snohomish County for the past 6 years. I am also a sister who lost her only sibling and younger brother, Tanner, to a heroin overdose at the age of 24 back in 2007. I attended this meeting last month and felt compelled to speak today in support of a second methadone clinic here in Everett. Being a citizen of Everett, I often hear my fellow neighbors and citizens complain that more needs to be done in terms of offering these folks treatment, housing, and other resources. However, when resources and solutions are developed, I hear those same folks say, "Not in my backyard." In addition, some of my neighbors and citizens of the city openly discriminate against those suffering from addiction, saying we should, quote, lock them up, put them all on an island, let them die, just to name a few. At this very meeting last month, there were some local business owners sitting in front of me, openly and quite loudly, making comments under their breath that were incredibly rude and biased, while people spoke in support of a second methadone clinic. Their lack of professionalism and open disdain for those suffering and those supporting those suffering was shocking, and I will not be supporting those businesses as a result. It saddens me, angers me, and makes me incredibly embarrassed to live among people who hold these opinions and refuse to educate themselves on addiction or refuse to open their eyes to more compassionate and humane points of view. Those suffering are someone's mother, father, brother, sister, spouse, partner, friend. No one deserves to lose their life over a preventable and treatable disease, and all are deserving of humane treatment, love, and compassion. As an addictions counselor working in this county, I can tell you that we don't have nearly enough resources to tackle this epidemic. And my hope is that there continues to be more resources available that we can offer to individuals in this area. We need to throw every tool and treatment modality we have at this epidemic. Medication-assisted treatment works. Harm reduction works. I think I speak for most of my fellow counselors when I say that we don't care where this methadone clinic goes. Just get it approved so we can get it up and running. I was frustrated to hear that this discussion has been going on for 5 months now. Meanwhile, the wait list at the current and only methadone clinic grows, and people are dying. Is methadone a fail-safe option? Of course not. But it is an option that is successful in many cases, and it needs to be available to more individuals. In the decades since Tanner's passing, many things have changed for the better. We have Obamacare, we have Suboxone, which is another medication to treat opioid addiction, and we now have naloxone or Narcan available to law enforcement as well as the general public at most pharmacies without a prescription. It has saved so many lives that may have otherwise been lost. Those lives saved have another opportunity to seek help and treatment if they so choose. Unfortunately, public opinion of addiction has not changed in many areas of our nation. It is difficult for me to accept this because I know that so many more people are affected both directly and indirectly. This epidemic does not discriminate, and if it hasn't yet touched your life, I guarantee that at some point it will. Tanner was a good kid, and he had a beautiful soul. And he was unable to properly address his addiction due to a lack of understanding about opiate addiction, both from professionals treating him and from his family and peers who simply weren't as educated on addiction at the time. A decade later, all of us now know better, and now we must do better. Please start tonight by approving a second methadone clinic, and let's move forward to provide more services to those who are suffering. Thank you.
Thank you. Howie Bargreen?
Good evening. I'm Howie Bargreen. I'm a citizen here in Everett, 2821 Rucker. Thank you, commissioners, for taking your time. Taxpayer citizens of Everett appreciate all your hard work, and I know I do. I would like to caution you when you're listening to the City of Everett's Legals Department. I've had some legal issues with them, and I've found often that they're wrong. I would also caution you to look into why, if the city comes up with this new idea that you can put these kind of clinics anywhere, that all the other cities around, including perhaps the city where your planning commissioner lives, Mill Creek, is keeping them out. But finally, I'd like you to just think for a minute why we are spending all this time worrying about people that are addicted, and that's very important. And my family suffered, like almost all of them, with the kinds of social problems we have. we seem to spend no time trying to concentrate on getting rid of the problem for good. And countries have. Singapore has. Portugal has cut their drug addiction in 75%. And I would just think that maybe somehow the city of Everett, the Planning Commission, somewhere we got to start thinking about how to look at a light at the end of the tunnel and get rid of this problem. And I worry that we're enabling too many groups that make a lot of money taking care of the problem that we have, when we really should be focusing on getting rid of the problem. Thank you.
Thank you. Daniel Mines?
My name is Daniel Mines. I live at 2431 Harrison Avenue. I am an artist, senior citizen veteran, reformed alcoholic. My friend John D. Mullinex and I brainstormed and tossed around some solutions for homelessness and drug addiction. I would like to approach with our schematics. Is that all right?
Sure.
Thank you.
That's good. We can share.
I would like to congratulate the city on suing the big pharmaceutical. I would like to congratulate the city for creating a homeless tower under Mayor Stephenson. My friend John D. Mullinex had been homeless for a while, and he now has a job. But his idea for a safe haven hostel, and we're knocking this out of the ballpark, is down by maybe the Everett Flatlands, the Everett Maintenance Yard, or near the Trestles, down there, with a facility with clothing room, tables, laundry, counselors, kitchen, administration, and security, with 10 by 12 rooms, each floor with communal showers and bathrooms, clean and sober guidelines. This is a one-night deal only. Each floor would have appropriate guardian. There may be a bunk room with partitions for single bunks or double. Handout of 2 survival blankets are free. Based on the Larch Mountain Correctional Facility in Vancouver, Washington, this would also have a bus line directly to the train station. These are one night off the street encounters. Each night requires a sign-up. There's no keys or lockers. This is not a hospital, not a jail, not a counseling center, merely off the street. My proposal is a little bit different. It concerns more like a homeless triage, and it could also go down by the flatlands. It would have it would be composed of the yurts with geodesic domes on them with a vinyl laminated fabric cover. It would have a cyclone fence. It would have anti-gump or honey buckets around them. It would have like 5 yurts, one for showers and washing, one for kitchen and the meeting and tables, one for laundry, one to treat the methadone clinic, and 1 yurt for administration and security. The cost would be like $150,000, very cheap, and they are almost prefab. I would like also to suggest that we bring our students from Everett Community College, even our high school students, our extension classes, to design projects like this, to see what their solutions and how they come up with things. How we could pay for these in taxes, perhaps paying field expansion taxes, perhaps condo redevelopment of the marina taxes. Why not marijuana tax, why not 1.5% tax for homeless initiative? Basically, even doing this would be a Band-Aid because the spiritual approach really needs to be addressed, and people need to go back on new spiritual beliefs and that are relevant with today's problems and with the nature of reality. Thank you.
Thank you. Shannon Swanson Myers?
Hello, I am the general manager at the Courtyard by Marriott, right on Colby and Wall, and I did speak at the last meeting, and I won't take up much time, but here again, just to speak purely from a business perspective, because of the location, and highly encouraged to stay out of the business district area. I know that part of the goal of the city of Everett is to really revitalize, and we want to be able to bring people back to the area again and again. And part of the things as we as hoteliers are trying to protect is the safety of the area that we address now a little bit as it is. So I just encourage you to really consider the location itself, and that's really it. Thank you.
Thank you. Michelle Fessler?
Hi, I wish to speak in favor of a second treatment facility. Our country is in the midst of a national opioid epidemic, and I believe it is the responsibility of the city of Everett to support the citizens of Everett who are suffering from addiction. Ignoring the problem or pushing it off somewhere else is not a solution. Letting people suffer in our streets and our parks is not a solution. Throwing people in jail is not a solution. Our prison system is not meant to or equipped to serve as a treatment center. I believe a second treatment facility where the need is greatest is one of the many important steps to finding a solution. Thank you.
Thank you. Well, that's all the people I had signed up to address the Planning Commission this evening. If there's anybody else, we recommend you come forward now and do so. Come on. Please make sure you state your name and address for the record.
Elizabeth Townsell, 5408 Rockefeller, Everett. And there were reminders in our last meeting before this Planning Commission that some of the addresses from the individual citizens were centered on a particular location. And it was made very clear, both from the commission and from staff and by some professionals in the audience who knew better, that you are making a decision to open up or to narrowly define your medical locations. You are not looking at permitting a particular location at this meeting. If I have that incorrect, I would be happy to have some education on that. But that is my understanding of why we are here today. So I will be educated later because you need to move on with your meeting. Thank you.
Thank you. Anyone else from the audience want to address the Planning Commission on this topic this evening? Seeing none, do I hear a motion to close the public hearing portion of this topic?
I move to close the public hearing.
Second.
Any discussion? Call for the vote.
Commissioner Yanasak?
Yes.
Commissioner Lavra? Yes. Commissioner Zelinski?
Yes.
Commissioner Beck?
Yes.
Commissioner Jordison?
Yes.
Commissioner Tisdall?
Yes.
Chair Holland?
Yes. Well, thanks again for everyone coming out and testifying this evening. It's good to get all perspectives on this very important topic. So
I have to say, I'm so impressed with the testimony we received. It's amazing.
So staff has given us a resolution for consideration. It's Resolution 17-08 with a few options. I just have one question for you, Alan. I know one of the options was prohibition of clinics in the B3 zone, and then the other one was restriction along residential streets. And in your memo here, it basically states that there would be some clinics that would become non-conforming uses, and was there any attempt to, I know this kind of came together quickly, was there any attempt to reach out to any of those folks so they had any prior notice of a consideration of becoming what's now a permitted and conforming use to a potential non-conforming use?
Not other than our general distribution list.
Thank you.
Actually, if I can ask a point of clarification. Now, for the facilities that would be considered non-conforming, is that considered non-conforming under precluding any clinic in the B3 zone, or non-conforming by precluding any clinics along retail in the B3 zone?
In both of the options, there would be existing clinics that would become non-conforming. Much fewer along the option 2 that would only prohibit a clinic on the ground floor along one of the retail streets.
I think we create a lot more headaches doing this.
So staff is looking for a recommendation, again, on Resolution 17-08. Is there any discussion on the two potential options that are not included in the current resolution, but were presented by staff?
I think that if we adopt any of those options, that we actually create some headaches for some existing clinics. They're pretty expensive facilities, and it would mean that they could never sell those facilities, such as what Everett Clinic is trying to do right now.
Yeah, I think they could continue to operate for as long as they're in existence, but there could be some minor things for expansions and substantial improvements and things like that.
I think we would create
but,
some headaches.
Yeah, so.
I keep reading David Hall's letter, and I've heard, obviously, there's some other opinions about the legal definition of discrimination, but I keep hearing the word discrimination. And, the Americans with Disabilities Act and Rehabilitation Act, they are entitled to the protections against discrimination afforded by these laws. I just don't, I don't know how we can continue to practice a policy that actually includes some discrimination. I mean, if a person with this type of addiction is considered a disabled person, how can we discriminate against them? How can we differentiate an opiate substitution treatment facility from any other type of medical treatment facility? So, the thing about discrimination is that it always seems okay to the people doing it until it's not, and then they find out it was never okay. And I want to be sensitive to the people who have concerns, but I see the memo from David Hall as being pretty unequivocal on this. So, removing the language of opiate substitution treatment facility from the definition of clinics, to me, seems like the only really reasonable way to go. I mean, you can certainly try other things, but, and I understand that state law does somehow allow the jurisdictions to weigh into this on how they're impacted, but I mean, if it was really an issue, then, if it were put before a planning commission or a hearing examiner, I think it would be pretty, I think they'd find that, yeah, well, a lot of this anecdotal thoughts on increases in crime and so forth they would be, they have to be proven, and it seems to me that he's pretty unequivocal that there is no case where it was found to be an issue where crime actually increased. And in fact, that's sort of counterintuitive. People are going to get help so that they can hopefully not be addicted and not have to go out and commit crimes to support an addiction. So I'm kind of, I haven't found anything. This is kind of where I came from. This is where I've been all along, but, I haven't found anything that was persuasive that could convince me otherwise.
I'll just make a comment. I am an attorney. I was immediately drawn when I saw the references to the cases. I read the cases prior to our city attorney Hall reading this memo. I had basically come to the same conclusion, and it was a question I had. And then when I saw this memo, it was not surprising at all to me to see that this was his conclusion. You don't have to be an attorney to be able to read those cases, and it's very clear what they say. I believe one of the cases was from 1999, the other one early 2000. These are not new issues. In fact, in one of the cases, I believe it was the City of Reading case from, I believe, the Second Circuit, one of the things that the court specifically pointed out is that the parties, there was a complete absence of any evidence indicating any sort of negative impacts from these types of facilities that would serve as a basis potentially for some sort of discriminatory action. And I don't think the question isn't one of discrimination. All laws, particularly zoning laws, discriminate. We discriminate between commercial properties, residential properties. There's discrimination. The issue is unlawful discrimination. And as the case laws point out, there are protected classes under the ADA. And I'm not I don't do that kind of law, but the case does point out that people in recovery do meet the definition under the protected class. So I guess in my mind, the question isn't one of, is this some sort of, can we continue to have some sort of policy that facially discriminates against these types of clinics? And to me, I think the law is clear that you can't do that under the ADA, under current case law. The question is simply, are we going to throw the baby out with the bathwater and prohibit all clinics, or are we going to just say that we can't discriminate like that?
I'd like to add that the court case that you're citing was actually for schools, and it was a 500-foot buffer that the state of, I think, Pennsylvania had around the schools. So they were dealing with the kid issue and found no evidence.
Right. And I guess to me what was significant is when you bring a case like there's significant resources poured into that, significant time spent preparing a case and preparing your evidence. And it would be natural if you had evidence of some sort of negative impact that you would present it in that forum, and that didn't happen. And I know we haven't seen any evidence of that. I can only conclude this because it doesn't exist. There is no such evidence. It has not been shown. That being said, I mean, I'm not insensitive at all to the concerns of business owners and to the downtown core. But again, to me, the issue is, I think the issue is, as later, it's one or the other. There's not a question of can we do this to come to discrimination. It's just, do we prohibit all clinics or otherwise?
All right. Commissioner Zielinski?
Yeah, I'd just like to make a comment. I think that the resolution that we have in our package, it's pretty clear that that's the way to go, in my mind at least it is. But I'm also sensitive to what I'm hearing from downtown businesses, and I would say in particular the Children's Museum and the 2 new hotels downtown, because those are facilities that people have discretion about going or not going to those facilities. And if people perceive that there is sense of maybe more marginal safety around that because of the population on the streets, then they're not going to go. They're going to find another alternative. They will not go to that hotel. They will not go to the Children's Museum. And that's going to undermine our efforts to revitalize downtown. So I'm very sensitive to those. I don't think that necessarily prohibiting all clinics in the B3 is the way to go, but I'd like to look at maybe some other options as we look at the Metro plan. And we are in the process of doing that, so I'm hoping that we can continue to look at perhaps refining the broadening that we would probably be doing tonight if we approve this resolution. One thing that came to my mind is the conditional use permit option, where you can look at the specifics of a site. Because tonight we're looking at a code, and a broad application of a code to wide areas of the city. CUP process can look, the hearing examiner can look in detail at the particulars of a site. Conditions can be put in there about proximity to sensitive uses, that kind of thing. But that's not what we're about tonight. But I would hope that we could continue this conversation beyond tonight.
Great point.
I think everyone here is sensitive to the downtown issues. I think we all hear that there are concerns. And again, we're looking at a code amendment that takes some stigma out of our current code that shouldn't be there. It's not about a specific site. But I want to make it clear, I really appreciate hearing from the Downtown Association on this issue. We hear you. It's part of the reason why we're moving forward with the Metro Plan. We need to address the concerns that are down there, but not this way.
Commissioner Lark?
I think there's been a lot of great discussion tonight, and again, I want to echo the concerns and thoughts that other commissioners have, the sensitivity to the needs of the downtown community, but also the need for helping people. Helping people is the right thing to do. But going back to what Commissioner Zielinski touched on and finding other ways in the Metro Plan, one thing that I was always taught in the Army is that when you are dealing with security, when you're dealing with people being worried, concerned, you can't be reactive to it. You need to build your strength. And I think Commissioner Zielinski hit on that. Finding ways as we go forward in the Metro Plan to start building on the strengths of downtown, to start building on the strengths of the businesses that exist in downtown and working to empower them and make sure that they are successful. With that approach of building up as opposed to reacting, I think is a better way to overall and overcome these challenges that we have. So that's just my 2 cents. It's a bit pie in the sky, but you know what? We'll refine it as we go forward.
Commissioner Tisdale?
I'm not against any person or protected class. My record will speak for that. I also have lost a family member due to addiction. Spent 7 times going through addiction before he ended his life. So I want to make sure it's clear that these folks have to want to. We build this, they're not going to come. And I want to make sure that I made that preference. Also, we have, I'm not as fixated on the Trask building as much as we've talked about one vendor. And when you look at that vendor seems to be okay. I can tell you from being down by 37th and Broadway that there was a small one located down there, and it was horrible. And it was about time to pivotally for Starbucks to close the store, IHOP, Subway. So I'm not talking about the folks inside the facility. I look at it like the mission. The mission is not the problem in the people inside, it's what they attract. And it's the perception. And some folks have talked about that perception. So I am involved in helping folks downtown stay here and move here. And the perception right now, folks, is not good. And we can tweak around with all the zoning stuff we want later. And I get what you're saying, Michael. But the perception is still there. And I think if we listen to that population and those folks that are investing their money and their future and all those things, I really think we're doing ourselves a disservice by not making sure that we make sure that downtown core is not subject to these types of potential and or perceived things. I understand the legal, understand that, and the protected class stuff, but we've also got another class of folks that have invested a heck of a lot of money in their life into a facility and a building to attract the economic engine that drives the services And so I really think that we need to work on a solution that helps make sure that we don't do a bunch of things and all feel good that we checked off the metro plan, but we allow things, whether it's this or something else, that's going to hamper that perception that we already have. Because unfortunately, we have it now. I don't have to tell any of you, you guys all walk those streets and stuff. So again, my point is, it's not about the people inside the building, it's about the people that it attracts outside the building, and I liken it to the mission. And I can speak from one that has been through those types of facilities with a family member, and I want to make sure it's perfectly clear that just because this is built anywhere doesn't mean that all the people are going to go to that place and get cured, and that the problem is going to go away. So I can't support this because my conscience of trying to help rebuild and retain the businesses that are down there. I think we're really doing a disservice to them and to our city's future by allowing it. Thank you.
Any further discussion on the resolution this evening?
I move that we approve it as written.
I'll second that.
Any discussion on the motion? Seeing none, we'll call for the vote. It's, what is it, 17-08?
Commissioner Yanasak?
Yes.
Commissioner Lavra?
Yes.
Commissioner Zelinski?
Yes.
Commissioner Beck?
Yes.
Commissioner Jordison?
Yes.
Commissioner Tisdale?
No.
Chair Holland?
Okay, we have our second item on the agenda this evening. Oh, Richard, thank you. I know you're gonna thank
I'm going to as well.
Okay.
Pleasure.
I got to go get my dad.
Okay. Yeah. Do you want me to, I'll give this to Alan.
Yeah.
Oh. Oh, gosh.
What are you going to do with it, right?
Don't believe me.
Don't spend it all in one place.
I'd rather just go on the track.
For some of that stuff, Richard.
Oh, thanks. Thank you. All right, thank you.
You bet.
I was going to ask you what your background was, so now I know.
Part of my background.
Thank you for your contribution. This is getting sold at the county.
I was working part-time, but I've stopped it. I'm back to full-time retirement.
Oh, great. Thank you. Much appreciated.
Hope I didn't scare you away.
I think you'd run into the same problems with the conditional use. You'd be tweezing it out again. But I hear what you're saying.
Well, conditional use may or may not be the answer. I wasn't really ready to support.
That would really help Everett. It's huge. I mean, so they actually had a retired so they had tons, and it's not just.
Well, Karen, we lost a couple of us, but
What did they do?
you still got a quorum up here, so.
Put me in, coach. I'm ready to go.
Because they were having to respond somewhat.
Oh, right, Vince.
So the second item that we have for public hearing tonight is actually a part of the 2017-18 docket process. And both of these are quasi-judicial matter. I just want to make sure that nobody had any ex parte communication on these two site-specific items. Seeing none, I'll turn it over to Karen.
Okay, thank you very much. So Karen Stewart, I'm an environmental planner at the City of Everett's Planning and Community Development Department, and I have a short presentation for you tonight on the annual updates to our comprehensive plan. So before you tonight, so you have item number 2 and then item number 3. So together, those comprise what we call our 2017-2018 docket. And docket is a term that we use to encompass these annual changes that, in general, state law allows us to update our comprehensive plan once a year. There are a few exceptions. So we begin this process typically in July, where we send out a solicitation. And then this year, we received 2 different proposals. The first one actually came from our planning department, and it's a request to make a map correction, essentially. Right now, and I'll go into that in a moment, but it involves amending a map as well as, and then I have a paper copy here on the bulletin board there, that's our comprehensive plan map, which then we're proposing to reference that and include it within the comprehensive plan as a new figure 6. And then the second docket item is a private property proposal from Alan and Annalisa Tolonoa, and they are requesting that the comprehensive plan designation and the zone for their property at 1609 Walnut Street be modified. So the first item, which is your item number 2, entitled Municipal Urban Growth Area Map Correction. What you see displayed here is an excerpt or a snapshot of the Snohomish County approved urban growth area map. And the particular areas that are highlighted with the yellow highlighter and the cross-hatched, I don't know that I have a pointer out, but I'll show you.
Down near the intersection, the other second one.
Are 2 areas that, as staff have been reconciling and making sure that our maps are as accurate as possible, have noticed that there are a few areas that we do need to correct. Thank you. Okay. So this is a snapshot from the map that you see here on so this is your adopted comprehensive plan land use map. And even though these are map corrections that need to be made to be consistent essentially with state law, which says that the county is responsible to establish urban growth areas in cooperation, talking with the city, we need to take it through this formal process. So I can, whoops. So the areas that I'm talking about are right in here, and then down by 134th Street in Ashway.
Quick question for you, Karen.
Yes.
So are those included in Muckletails and Linwood's UJ? Is that what the reconciliation was about, or?
Actually not. So the southwest portion of Snohomish County has multiple cities, and there are areas within that are still in unincorporated Snohomish County and are not assigned to any particular city's municipal urban growth area. In the case of these properties so the dashed line is the city limits, and what I'm trying to talk about is this line here that is dashed but has an orange highlight. That's showing on our current adopted city map an erroneous urban growth area that's not correct with the county's adopted boundaries, and so we just need to adjust those 2 areas.
So, but if the city plans for those, or takes them out and doesn't plan for those areas, there's no opportunity for that to be incorporated into the city in the future then? If we're not planning for those areas, even though that hasn't been assigned by the county to a particular MUGA?
our planning director will answer that question.
Yeah, thank you, Ellen Giffen. For the property that is along Airport Road, those properties that are outside of the county designated municipal urban growth area, or our designated urban growth area, are county-owned properties. They're affiliated with Payne Field, and county has established that they do not ever intend to give up jurisdiction, land use jurisdiction or planning jurisdiction over Payne Field. And so that is the reason for that area not being consistent with our comp plan map. Our designation goes back before there was a MUGA, or municipal urban growth area boundary, and so this is a cleanup action to make our map consistent with the county's.
Right, I understand. Thank you.
And then the other area to the south along Ashway is just a mapping error once we reviewed it. So in your Exhibit 2 that's attached to the resolution, you have more detail of the particular areas that we are talking about correcting tonight. So this is resolution number 17-11 is the proposed resolution, and you'll notice that there are 2 exhibits attached to that. In addition to the mapping change, Exhibit 1 shows the proposed addition to the comprehensive plan text by adding the reference to the map as Figure 6. So I'll pause there, since we have 2 different resolutions for your consideration tonight.
Karen, I have that one as 17-10, and then the second one on Walnut is 17-11.
Okay, I stand corrected. Let me double check with Kathy.
We're missing an 09. Was there another one that we did already for the? Oh, okay.
Here it is, here it is, here it is. I've got it.
Okay.
Oh.
So, do we want to take public testimony on that particular
No.
docket item? If there is anyone that would choose to do
Personally
so?
looked at these and realized they were just cleanup activities.
Yeah.
That's all
Recommend
they
that you
are.
open and close the public hearing.
I'll make any of them.
Yeah, it's
Um,
minor technical.
Sir, would you like to, no public testimony? So do I hear a motion to close the public testimony? We don't have anybody here that would like to testify on this particular docket
Close the
item.
public testimony.
Second.
All
Any
right.
discussion? Okay, call for the vote.
Commissioner Lark?
Yes.
Commissioner Yanasak?
Yes.
Commissioner Lavra?
Yes.
Commissioner Zelinski?
Yes.
Commissioner Beck?
Yes.
Chair Holland?
Yes. So they're looking for a recommendation for the Planning Commission on Resolution 17-10 for just some correction of both a map and text within the comp plan. Do I hear any discussion or motions on that resolution?
I'd move approval of the resolution.
Any discussion? Okay, call for the vote.
Commissioner Lark?
Yes.
Commissioner Yanasak?
Yes.
Commissioner Lavra?
Yes.
Commissioner Zelinski?
Yes.
Commissioner Beck?
Yes.
Chair Holland?
Yes.
Okay, thank you. So then moving to item number 3, which is the second docket request for your consideration tonight. This would be proposed amendments to the comp plan as well as the rezone. And it's for this property, which is a existing home located at 1609 Walnut Street. It's a 2-story dwelling. And
And I had no issue with this. Upzoning it.
the neighborhood that it's in the vicinity of is North Everett and located south of 16th Street and just north of, try my pointer again, of the Henry Jackson Park, which is located right here. And the property is right here. And of particular note in this area is that the property is served by an alley. And the entrance, in addition to a garage in the back, there's parking here. And you saw the front of the home, which looked like a single-family home with the one entrance. It's in the back that there's two entrances, one to the upstairs and then one to the downstairs unit. So the proposed designation change is because the property owners would like to have 2 units and have the home allowed to be used as a duplex. In order to allow that kind of a use within the current zoning, with the size of this particular lot, there's a requirement to change the zone. So in order to change the zone, they needed to make sure that it was consistent with the comprehensive plan designation. So that's why we're here tonight, is in order to support the rezone. The comprehensive plan designation also had to be changed. And so what they're proposing is their existing 1.3 single-family detached, that they would like to change their comp plan designation to 1.6 multiple family. And then that would support the proposed rezone from single-family detached medium density residential to, so that's the R2, would support it to the R3 multiple family medium density. And this shows that that's adjacent to that type of zone on the 3 sides.
Karen, in review of your staff recommendation, it doesn't look like there's been any public comments on this at all from the surrounding property owners, and I'm sure there was notice that was given both in the environmental review and then at the application stage, I assume.
Right. We have not heard any comments.
Now, did we look at a broader area then, maybe to bring that boundary down to the south end where it squares in a block or anything like that, or?
So that was something that we requested of the applicant, so there is a single-family home right here at 1611 Walnut Street, and the property owner said he was not interested in joining this proposed change, that he wanted to keep his existing zoning. So, and then just north of the property, that's an existing duplex. Then up on the corner, Walnut and 16th, that's a triplex. Across Walnut, starting up at the corner, that's a 4-plex. Then south of there is 6 units, and then south of that one at 1614 is 6 units. Across the alley at 1610 Chestnut Street is a 5-unit complex. So there's a lot of multifamily development with people renting in that neighborhood, so that's definitely consistent with that.
Right.
And could potentially reflect that we didn't get any contrary comments. The property was posted, and there was a legal ad in the newspaper also, but you're right, we did not receive any comments.
So the small little single-family house, he wasn't interested, but he had no problem with his neighbor, basically.
Right, having a duplex.
Why
It was
not go
fine.
ahead and, it's an upsell.
So in terms of putting together our staff recommendation, you do have our staff report. And basically, looking at this proposal, we evaluated compatibility with the neighborhood, which I just sort of went through that it's primarily multifamily development. And then determined that the land use designation criteria that are found in our comprehensive plan, that, and this is detailed
on page 3 of our staff report that 5 out of the 7 criteria, locational criteria supporting this comprehensive plan change were met. And the requirement is to have at least 3. So we had more than enough consistency. And then the rezone would be consistent with the proposed land use designation. So staff recommends approval of these proposed changes. And that is Resolution 1711, correct? In your packet?
Did you want to address the planning commission? Okay. So do I hear a motion to close the public testimony for?
So moved.
Second?
Call for the vote, please.
Commissioner Lark,
Yes.
Commissioner Yanasak,
Yes.
Commissioner Lavra,
Yes.
Commissioner Zelinski,
Yes.
Commissioner Beck,
Yes.
Chair Holland.
Yes. Okay, well, thank you, Karen. Well, we have Resolution 17-11 for your consideration, discussion, or motions. I personally don't have any comments on
Any
it.
questions?
so-
Seems pretty, yeah.
Yeah.
I
Very
move
clear.
that we, go ahead.
Oh, I was just going to say, I read it, and it's very, makes sense, and everything was clear, so.
I move to approve?
Resolution
Second that.
17. Any discussion? Seeing none, we'll call for the vote.
Commissioner Lark,
Yes.
Commissioner Yanasak,
Yes.
Commissioner Lavra, Commissioner Zelinski,
Yes.
Commissioner Beck,
Yes.
Chair Holland.
Yes. Thank you. Any other business tonight, Alan?
Nothing more from staff.
Okay, well, thanks for all your work on our opiate substitution facility, and all the, especially all the residents and business owners that come out and testify. I think it was a great topic and a learning experience, and hopefully we don't see any negative impacts if ultimately a facility is located in the downtown, and hopefully they find the best location for their business model and not necessarily, where it's going to end.
Treatment.
Yeah.
And there's a
Treatment
siting
model.
process, so, and it could go anywhere in the city, so.
So,
A lot of open. a lot
anyway,
of
it's
space
great
for
discussion by the commissioners and much appreciated, and
I was
tough,
impressed
tough
with
decisions, so.
Testimony. I thought the testimony was just phenomenal.
It was more phenomenal, it was more organized tonight, I think.
It was, we had incredible speakers, with different opinions on both sides of it.
Yeah.
That was pretty.
With that, welcome Commissioner Yanasak, and pleasure to have you on
Happy
board.
to be here, much to learn.
And I believe we have one other new face starting next year?
Carly McGinn is the other commissioner who's been appointed to a new 6-year term. She was going to be here tonight, but had a cold and decided she didn't want to share it with the rest of us, so she'll be here at our first meeting in January.
Great. Well, with that, I guess we're adjourned for the evening. Thank you.
Thank you.
And Merry Christmas to everybody. Yeah, Happy New Year. We'll see you next year.